About 100 protesters are here to support Dr. Paul Marik.
You've done something that's so transformative, that's so maverick.
Dr. Marik has treated over 150 septic patients the same way. Time after time, they survive.
Dr. Paul Marik teared up outside the Norfolk courthouse Thursday, surrounded by a group of supporters.
And what they're basically doing is telling me how to treat patients and what to use and what not to use.
Dr. Marik has been cited over 48,000 times in peer-reviewed publications and is certainly one of those doctors who've been persecuted for treating patients.
What's happening now is completely unprecedented in the history of medicine and across the world. We have the federal government, we have state agencies and hospitals telling doctors how to practice medicine. They're interfering with the sacred patient-physician relationship.
Dr. Marik had been reading about the healing powers of vitamin C and just on a hunch gave it to Valerie intravenously along with hydrocortisone.
This is quite miraculous in that patients who are critically ill, who are at death's door, when we give them this very simple combination of medications, it turns around their septic process, and within hours they significantly better.
Reaction from the medical community to what you had proposed and done has been very mixed at best, hostile at worst.
People are displeased with me because here we found a very simple, cheap, easy way of dealing with sepsis. They just didn't like the idea that a vitamin, which is cheap, could save people's lives. It was against the narratives.
The question is to you. If your daughter was in the ICU dying of septic shock, would you deny her a therapy that we know absolutely for a fact is safe and that may potentially save her life? That's the question you need to ask. There are no downsides. There are absolutely no downside. The only downside is you may save the patient's life. To deny it, I think, is unacceptable.
Traditional medicine does not like challenges to the status quo. We need a reawakening because this current medical system is broken. Our goal now is to educate clinicians, healthcare workers, and the public that they need to be empowered, and we hopefully will live happier, healthier, and more fulfilling lives.
Well, it's my honor and pleasure to be joined by Dr. Paul Marik today. Really.
Thanks, Del. It's always an honor to be here. You're one of my heroes.
Well, then feelings are mutual. You know, the other times that we've had you on the high wire, we've been talking a lot about COVID and all the work. You know, obviously, you really were one of the ones fighting for repurposed drugs to save patients. You had that incredible testimony with Senator Ron Johnson, the emotional testimony where you basically said, I was forced to watch my patients die when I could have saved them. But I don't want to really, let's move beyond that a little bit today, because your work before COVID really is instrumental, and that came under attack. We've talked before about vitamin C. So just to remind people, what was the actual discovery of vitamin C when it comes to sepsis, which is a major issue in ICUs, right?
Yeah, so the World Health Organization estimates that about 11 million people die of sepsis every year. It accounts for about 50% of deaths. So it's a...
Is that the leading, would that then be the leading cause? It seems like that's pretty high up there.
It's the leading cause of death in children, and obviously it's about third or fourth in line in terms of adults. So it is a very important cause of death. And, you know, it's treatable and it's preventable.
But it wasn't always. I mean, this was a real problem in hospitals before you made the discovery. So how did it, you know, really sort of, how did it work? How did you discover vitamin C in this?
Yeah, so it's an interesting question. So what people may not recognize is that almost all species on this planet, except humans and guinea pigs, actually make vitamin C. And it's really not a vitamin, it's a stress hormone. So when your cat or dog is stressed, what it does is its liver makes vitamin C because it's an important stress response. Humans have lost that ability. So then the obvious next step would be when humans are stressed, give them vitamin C. And the more stressed you are, the more vitamin C you need. And probably septic shock, which is a severe form of sepsis, is the most extreme form of sepsis and one of the most extreme stressors on the body. So it only makes sense to give vitamin C because it's a stress hormone. And so this was really built on the work of many people before me, but particularly Dr. Fowler at Virginia Commonwealth University did a study looking at vitamin C in sepsis. And so I'd read his work and I thought, that's really interesting. I kind of stuck it in the back of my mind. And then when I had this patient who was dying, doctors, traditionally do what they can to save a patient's life.
All right,
that's what we do.
That would sort of be the jam, I would think, like to be able to say, I saved someone today.
Yeah, that's the Hippocratic principle, which seems to have been lost, that doctors will do whatever they can in their power.
Yeah.
They'll think out of the box because, when a patient's dying, they're dying.
Right.
What do you have to lose? And so you'll try anything within reasonable bounds. So this patient was clearly dying, and I remembered the vitamin C study. I wasn't sure on the dose, so he had postulated 2 different doses, so I went smack in the middle, and I thought, for good measure, I'm going to add corticosteroids because I had, long studied steroids and thought they had a role in sepsis. And for good measure, I threw in thiamine, so I gave the patient this cocktail of vitamin C, hydrocortisone, and thiamine. We called it the HAT protocol. And so in this first patient, I was not expecting anything. You do what you have to do and you hope for the best, but you assume the worst. And the next morning, I was completely dumbfounded. She was sitting up in bed. Her kidney function had improved. Her liver function had improved. We actually took her off the ventilator and she walked out of the ICU 3 or 4 days later.
Wow.
And so obviously, one swallow doesn't make a summer. So I thought, what, I'm going to do that again. So, in discussion with our nurses and the patients, we did this again and again and again and again, and we saw the same thing. And so at that time, I really didn't realize what we were doing because patient came in the ICU and we treated them immediately.
Yeah.
It's such an obvious thing. And so that's really the key, is early treatment. They came to the ICU, they were critically ill, we gave them antibiotics, we gave them a little bit of fluid, and we gave them HAT therapy, which seemed like the obvious thing to do.
Right.
And so that's really was the key to the success, is early aggressive treatment. And my friend, as you highlighted, Pierre Corey, had the same experience. Unfortunately, what happened, with the powers that be, is whether by design or just because of sloppiness, they designed or did studies which were going to fail. And essentially what they did is they gave the vitamin C cocktail at least 24 hours after the patient came to the ICU. They gave antibiotics, they gave fluid, and they delayed treatment. And so it's pretty obvious.
It seemed like, I know and we've talked about this before, like about a lot of different studies, but where they set out to try and make the product fail instead of saying, let's use it exactly the way Dr. Paul Marik is using it. Of course, you had published on this, that your publication was accepted and touted worldwide as a cure. Here it was, hydrocortisone, vitamin C, and thiamine for the treatment of severe sepsis and septic shock, a retrospective before and after study. This was seen by tens, hundreds of thousands of physicians and people around the world. But then, as pharma usually does, they sort of attacked, and they attacked from several positions.
Yeah, so you're absolutely right. What they didn't do is try and replicate my study.
Right.
That's not what they tried to do. They tried to disprove the concept.
Right.
And so there are really 2 important things that actually I realized after the fact. One is timing, that it must be given early. And secondly is we chose medical patients because medical patients are patients that have a medical disorder that responds to medical therapy. If it's surgical sepsis, for example, you have a ruptured appendix, you have a ruptured gallbladder, that's a surgical problem. And trying to give vitamin C to treat a surgical problem is obviously doesn't make a lot of sense.
Right.
So our paper was only medical patients because that's where it has a role. Many of these other studies enrolled patients with surgical sepsis
Okay.
because they knew it wasn't going to be a benefit.
Right. Very
What you need is it's obvious, you need a good surgeon. You know, when you have a ruptured gallbladder, you need a good surgeon.
Right.
While vitamin C will help and is part of the treatment algorithm, what you need is a surgical intervention. So they didn't replicate or duplicate the study that I did.
And so, you know, last time you were on, we talked about this event in, is it Belfast? I think it
Belfast,
was,
yeah.
where they brought you out, basically tar and feather you. They took one of these studies that refuted your statement, made you sit in front of this giant scientific body and try to humiliate you. Your paper has been under review. And one of the attacks, though, what we're here to really celebrate is, I think, one of the great victories I'm finally able to talk about on this show. So many scientists whose papers are retracted and pulled and yanked, and you know it was solid, you know it was done right. They're not being given any opportunity to refute the arguments being made. And we've talked about this. This is the scientific method. The way these journals are designed, you put forward what you found. Other scientists are allowed to attack it, even with a study like you said, but then you come back and say, well, look, you added people in your study that, you know, had surgical sepsis. I never said that it would work there. And you didn't do it in the timing or use the protocol the way I did. And then we all get to read everybody's statements on this and decide whether or not we want to add to this. This is how science is supposed to work. Instead, they keep yanking these papers, yanking them down, and disappearing these foundational principles that maybe need adjustments or should be a part. I'm not against the scientific method, but the method is dying here. But you decided to sue. And so I want to get into this story. First of all, just so you know, folks, that, you know, a doctor decided to attack Dr. Paul Marik's perspective. This was an Australian doctor named Kyle Sheldrick. And this is what I think it started out, he tweeted out, thanks, somebody linked the Marik study an hour or two ago. It is clearly fraudulent. I have requested retraction. A copy of my complaint is here. He did submit this complaint. This is it. This is what he had to say. Unfortunately, within about 5 minutes of reading the study, it became overwhelmingly clear that this is indeed research fraud, that the data is fabricated. While I understand your need to act fairly, there's overwhelming and irrefutable evidence that data presented in this paper cannot have come from the method described and can only have been fraudulent, even from the data in the paper alone, without any further evidence. I urge you to retract this paper, or at least issue an expression of concern as soon as possible. I have CC'd the institution's integrity officer in case they wish to institute integrity investigation proceedings and disciplinary action. Just out of curiosity, is he an ICU doctor? Like, what gave him the foundation to believe he had this level of expertise?
Yeah, so what's interesting is this came 4 years after the paper was published. So that should firstly raise a red flag. Secondly, he's some kind of an orthopedic doctor, as I understand.
Okay.
He's not a statistician. He's not an ICU doctor. He doesn't treat sepsis. So his background in both ICU medicine, sepsis, and statistics is just not there.
Wow. And so why did you decide to bring a lawsuit against him?
Yeah, so we actually took legal action against him rather than specific lawsuit. You know, that's what it's kind of called. So obviously what he did, you know, he accused me of fabricating the data. And it essentially was defamation.
Okay.
So obviously I had to defend myself.
Right.
I had to defend the study, and I had to defend what it represented. And so, you know, so firstly he tweeted this out. It then went to many of the social media medical organizations who assumed I was guilty, you know. Without actually investigating the information, I was assumed to be guilty. And so, you know, his accusations were pretty interesting. You know, he claims that after reading the results, in 5 minutes he knew it was fabricated. But the statistical techniques he actually used were completely unfounded. And we had real statisticians look at what he had complained of and found his thought process was not correct. But nevertheless, the Social media medical organizations took it seriously, and I was assumed to be guilty and having assumed to have committed, scientific fraud.
Wow. Yeah.
And so obviously the complaint went to the medical journal, and they obviously had to take it seriously, which they did. They went through I provided the data, and initially they said they found no credible evidence for his claims. But then they received a second complaint, which was anonymous, stating that my inclusion and exclusion criteria were very suspect. So that led to another year-long investigation. Finally, the journal basically vindicated me.
Wow.
Basically, they said they can find no data or no evidence to support his claims or the subsequent claims. And after having statisticians and methodologists and clinicians poring over the paper for over a year, all they could come up with was two words in the entire paper that they wanted me to change in the methods section.
Okay.
So the results stood, the conclusions stood, which is really astonishing, because you can take any medical paper and you can find fault with it. It's
Right.
just the way it is.
Yeah.
And so they, after a year of intense dissection, two words
had to be.
is what they want to change, which were really inconsequential in the whole paper.
People are going to ask, what were the words? I mean, without getting too deep in the weeds. I know they're like, what are the words, Del? Why didn't you ask?
What are the words? So the two words is, we said they were consecutive patients, but in a clinical trial, it's very difficult to be absolutely get consecutive patients, because you don't have researchers there all the time. Some of the patients you just can't get access to. We had to change consecutive to non-consecutive.
Okay.
Because we originally said consecutive, but we meant consecutive patients that we were able to enroll.
Got it.
If it's 2 o'clock in the morning and there's no clinical investigator around, you can't enroll the patient. That
Right.
happens in all clinical trials. Your goal is
So
to
there's
get
the ones that you consecutively put in, but not necessarily everyone that came to.
Yeah, so they were trying to imply there was a selection bias, but we actually showed them with the data. We tried as best we could to enroll consecutive patients,
Okay.
which is what we did. And the second was the dose we wanted was 1.5 grams Q6, but this was a pragmatic study. So the pharmacies didn't always supply the dose exactly every 6 hours in the way we wanted it. So we targeted a dose of 1.5 grams Q6, because sometimes it wasn't Q6, sometimes the patients left the ICU a little bit early. So the two words they want to change was consecutive to non-consecutive, and the dose had to be, we targeted this dose.
Got it.
And so if anyone who knows anything about medicine knows that's what happens every day in real life.
Right. Well, awesome. So not only you vindicated, not only around the world now, all of these attacks on this paper, it stands, the evidence stands, the claims of fraud have been wiped away, and this chucklehead that decided to attack you, what did he have to do? I mean, what was it, you sort of brought this litigation his direction, or at least to,
Yeah, so obviously
legal action, as you put it.
Yeah, obviously what we wanted him to do was to recognize that he'd made a mistake and to make a public statement recognizing that his accusations were not grounded.
So you didn't ask for money or retribution for trying to destroy and smudge my career. I believe we have this statement. Can we take a look at this? Here it is. A statement. On 22nd March 22, I posted a blog post called The Scattered Corn. This post was a copy of a complaint I filed with the journal Chest, identifying features of a study led by Paul Marik titled hydrocortisone, vitamin C and thiamine for the treatment of severe sepsis and septic shock, published on 3rd of February, and identifying that I believe them to be signs of fraud, and linked to this on Twitter. Those complaints have since been formally rejected by the journal Chest, which I consider to be the definitive conclusion to the matter. I realize that this letter was used to imply that Dr. Marik personally acted deceptively and falsely reported study data, which was not my intention, and this caused him significant hurt and distress. I regret this hurt to Dr. Merrick. I will inform those who have reported on this complaint that it has been rejected by the journal. Dr. Merrick has also indicated to me that some subsequent controlled studies have found some positive outcomes for vitamin C in sepsis, and I accept this. This statement is not an endorsement of the use of vitamin C in sepsis. Well, he can go ahead and go on his merry way. I just love this because, you know, I think so many times people just walk off and just let this abuse continue. And you are not only winning for yourself, you're winning for science. We've got to start standing our ground in these situations. And, you know, when you think about this issue of sepsis, I mean, you know, what is your dream that the treatment will be, and what could it do for people around the world?
So Del, I must say I am grateful to Chest, because the journal Chest, they could have taken the easy route that many other journals have done.
Yeah.
And under pressure just said, you know what, this is scientific fraud and we will retract the paper. So I'm indebted to them for standing up for the truth, for standing up for science, because ultimately that's what we need to do. You know, all of us need to stand up for the truth, because the truth will always prevail. And so although they tried the best to take me down, they failed. And I think it's an important point, because this was a win personally, obviously, for me, but more importantly for science, that scientific truth and integrity can survive. And it's also important for the vitamin C protocol, because otherwise it would be assumed that, you know, our protocol was fraudulent, it was based on false data, and would have buried the use of vitamin C in sepsis. And so now I think it resurrects this very important form of therapy.
Yeah.
And so let me say this again, timing is important. So there's no reason across the world, vitamin C is cheap. It's non-patentable.
Yeah.
So that's why Big Pharma doesn't like anything they can't patent. So there's no reason that people across the world who have severe sepsis can't be treated with a similar protocol, which is very simple, it's very cheap, it's very safe, and has the potential to save lives. And so what more important a task should we have than to help people save their lives? And many times, these are people who, when they recover, much like my first patient, recover completely. These aren't people who have severe comorbidities. These are people who have the potential to recover and live healthy, meaningful lives. And as we said at the beginning, you know, sepsis accounts for about 50% of deaths in children. So there's no question of doubt that this is a treatment modality which we can build on. You know, sepsis is an important cause of death, and so timely use of antibiotics, really important, appropriate management of fluid, and then adjunctive therapy with corticosteroids and vitamin C can be very helpful.
Well, I mean, that's a huge win for science and medicine, but you sort of had a huge personal win, I would say, in your own health. So I kind of want to get into that a little bit, because it's really fascinating. And my understanding is this story sort of starts with COVID and the vaccine, which we've talked a lot about. But what was it about spike protein, COVID, the vaccine, that sort of got you into a health kick?
Yeah, so basically this started a new journey for me. And I suppose I was a traditional physician. I was a professor of medicine. I was tenured. And I believed everything we were taught and everything we were told. I mean, that's what doctors believe.
Yeah.
And I had no idea the extent to which medicine has been bought and corrupted and deceived. And so COVID.
I mean, you're a professor. You run an ICU. I mean, it's amazing that someone, because you imagine from a lay perspective, imagine if you get as high up as you were, you know, cited by tens of thousands of doctors around the world and all the work that you've done. We assume that you don't get that high without seeing all the skeletons in the closet, right? You just sort of have to imagine you would have, if there's a problem, Dr. Merrick would have seen it.
So I always was a person who challenged the status quo, because I think scientists have to do this. You have to have an open mind, don't believe anything. But despite having an open mind and despite challenging, I was brainwashed, as almost every clinician is. Not so much in terms of ICU medicine, because ICU medicine is based on, physiology and manipulation of physiology, but just in terms of medicine in particular. And so my journey really started off with figuring out how to get rid of spike protein.
Okay.
Because there are these questionable practices of detox. And detox is something which doesn't work. The body has enormous capacity to heal and self-heal. And that's part of how vitamin C works. It helps the body heal itself. And so I came across this process called autophagy or autophagy, where the host or the cell basically gobbles up these bad proteins in the cell. It's called autophagy. It's truly astonishing. I mean, the human body is so brilliantly designed.
Yeah.
Whoever designed the body did a really good job. A really good job. And so there is this process called autophagy, where the cell gobbles up misfolded, damaged, bad proteins. And the most efficient way to stimulate or activate autophagy is by something called intermittent fasting or time-restricted feeding.
And so what was why did you have the focus on spike protein yourself? Why were you concerned? Had you gotten the vaccine?
So not for me, but I was interested in how we could help these vaccine-injured patients.
Okay.
As you know, there are quite a few of them in the U.S.
And FLCCC, of course, the work that you and Pierre Corey have done, you've been on the front lines with that. And
so you may know about the ICANN group.
Yes,
you heard
them
about
too.
Them?
They're really great.
And you heard about the, the VScan study, which shows that 18 million at least vaccine-injured people.
Yeah.
And so obviously this is a humanitarian disaster. And
Right.
we have to figure out a way to help these people. And so I figured out that one of the ways to do this was through intermittent fasting. And through this journey, I realized that intermittent fasting actually may be the solution to many other medical problems. And so I was a type 2 diabetic. In addition to being a type 2 diabetic, I will admit this on TV, I was a food addict.
Okay.
And so what you may not know is maybe 80% of Americans are addicted to processed foods. It's a DSM-5 diagnosis. This is a real psychiatric diagnosis.
Wow.
And I was a food addict. And we can talk about what the features are of being a food addict, which is, eating processed foods, snacking, eating bad foods, eating processed foods.
Yeah.
And so what I figured out was that...
What's your weakness? Is it sweets? Is it salt? For me, it's like chips and things like that.
Yeah, it's changed. So I'm no longer a food addict. I'm a rehabilitated food addict.
I'm glad to hear it.
So what I used to do, this is what I used to do when I was like a normal human. I'd go to work, I'd go to gym, I'd come home, then I would sit in front of the TV and eat chips.
Okay.
I would eat chips and snacks and potatoes and candy like for hours. Wow. I was a processed food addict.
Okay.
That's what I did, and that's what many Americans do. And then I realized that, I was an addict, and I realized that what I needed to do was to eat real food. Imagine such a thing like that. To eat real food and to do intermittent fasting or time-related feeding. And so that's what I started doing. I lost 40 pounds within a few months, and the diabetes that I had went away.
When you say intermittent fasting, for people that may just be sort of tuning into this, or time-controlled eating, what system are you using for your body?
Yeah, so it's really important to distinguish starvation, because this is not starvation.
Right.
The second thing is that diets don't work.
Right.
If you are a food addict, the diet doesn't work. It's like telling someone who's an alcoholic, just don't drink, or someone who's addicted to cocaine, don't take it.
Right.
The diets don't work. This is a mental disorder, so you have to get to the problem. And so I changed my philosophy about eating. My approach to eating changed completely. And it took me a little bit of time to adapt, but it's not difficult. So basically, I stopped all snacking. I stopped snacking. And then what I did was I ate between a window. So you want to eat, the easiest time-restricted feeding is miss breakfast, and then eat between a 6 to 8 hour window. The rest of the time, you fast.
Okay.
Fasting means you don't eat.
Right.
And you can drink, you can have fluids, and you can have coffee. Coffee is actually really good. Coffee prevents Alzheimer's disease, prevents dementia, it prevents cancer, and it activates autophagy. So coffee is really good, as long as you don't have it just before you go to sleep. Right. So I changed my diet. More importantly, I changed my lifestyle and my approach to food. So before, when I ate processed food, so I went to the cupboard, where we keep all the food.
Yeah.
I threw out all the processed food, just dumped it out. And what I kept was real food. And so what's the difference between real food and processed food? Is quite simple. If it looks like food, it's food.
I tend to think if I can't, if it has more than like 2 or 3 words in describing the ingredients inside of it, and certainly if you cannot understand what the word is or means, probably not real food.
It's probably not food, yes. So if it comes in a box and has a label or comes in a package, it's probably not food. And the longer the ingredients and the more undecipherable the ingredients are, that's not real
I almost
food.
ate a little snack pack, honestly, just the other day. I was on the plane. It was like, it was like a little snack mix. And I was like, oh, hold on a second. I turned it over to look at the ingredients. And it was like, it was bigger than the package. It wrapped the package. And it was like, I was like, what would this little snack need this many ingredients in it?
And so many
really
of the
amazing.
additives actually are addictogenics. So they are put there by design to make you addicted to the food that they're making you eat.
Wow.
And so there's actually some good data, an award-winning lecture which actually showed that the processed food that we eat actually causes oxidative injury in the pancreas. It actually damages the pancreas and causes the pancreas to release insulin, which may be part of the reason for type 2 diabetes. It's the chemicals, the colorants, the toxins in synthetic food. So we're not eating food.
Right.
We're eating synthetic chemical compounds.
Which are causing diabetes.
Which are causing diabetes, and they're causing a whole host of other disorders. So it's really getting back to nature and getting back to the way we were meant to be.
And so and was there any guidance? Were there any books or anything you read that sort of led you towards this?
Oh yes. So what actually took me on this journey is a book by Jason Fung, who's a nephrologist in Canada who wrote the book, the Bible on intermittent fasting. It's an outstanding book. So I have no investment in his book or in him, but it really, if anyone's interested in intermittent fasting, I would truly recommend this book, because it's a very simple, he lays it out in a way that anybody can do it. This is not complicated. The nice thing about time-related feeding is you can adapt it to any lifestyle, any person, anytime. It's simple. It doesn't cost you anything.
I'm doing the same thing, by the way. I mean, everyone that's watched this show for the last couple of years watched me almost die. I guess it was almost 2 years ago now, a year and a half ago. Where, I mean, again, I was, thought I was being healthy even. I don't really eat a lot of, bad foods. Some, I guess, when you travel a lot, and just working too hard. But I have really looked at my diet, looked at things chips, I have these weaknesses. I'm eating whole foods in the middle of the time, but you're right. I'm having a nice breakfast with eggs and, toast, but then I have chips and, for me, it's the salt and oils and things.
It's the addiction.
Yeah.
And so, what, if you think of it in that terms, that, this is not a personality trait. You are addicted to the substance.
Yeah.
And the data shows that carbohydrates and sugar and fructose is more addictive than cocaine.
Wow.
If you were to give mice in a laboratory cocaine or sugar, they will choose sugar.
All right, well, let's show them your results, because this is outstanding, folks. And this is one of those things, you're watching this show, a lot of you say, well, we talk about problems all the time, but how about some solutions? Look at, you were monitoring yourself as you went through this process, which is really cool. I'm glad you did it. So we have some graphs and some things to show you. This is your continuous glucose monitoring. What is it, when we look at this, what does this mean and why is this important?
Yeah, so, we have the technology now to monitor blood glucose continuously.
Yep.
So if I'm a bad boy, I do what you did and ate a bag of chips, it would cause my blood glucose to spike. So my blood glucose runs around 100, which is really quite good.
Yep.
What would happen is if I do what you do, or did, or sometimes did,
Yeah.
it would shoot to 200. And so what that does is, firstly, it tells you you've been a bad boy
Yeah.
or girl.
Yeah.
Secondly, it gives you this instantaneous biofeedback. So you can tell what different dietary elements do to your own blood glucose.
Wow. Can anyone do that?
Yes.
Really? So you can sort of monitor, go through a day and just say, how are these things I'm doing really affecting my body?
Very effective biofeedback because we're all different. We
Okay.
all respond to foods differently. But it basically tells you how you personally respond to any particular food type. And so it may even differ from day to day or for the time of the day. Or the order in which you eat food is very important. So there's a woman in Sweden, I think, who's known as the glucose goddess. And she wrote a book, it's very interesting, that the order in which you eat food can determine your glucose profile. So if you eat carbohydrates at the beginning of the meal, it causes a big spike. But if you start the meal with greens and fiber, and then end with carbohydrates, say a sweet, you have a much flatter blood glucose
Interesting.
profile. So it becomes very important in teaching you, you're learning how your body reacts to a particular food type or group of foods. And there's no question it's instantaneous biofeedback. It moderates your behavior.
Wow.
So through the blood glucose monitor and also then monitoring, my hemoglobin A1C, my blood pressure, my
Well, we
weight.
can show that. We can show your A1C throughout this. You can see these are, as the weeks go on, you started out, your A1C was at 8. Also, you have your weight there, and the what does that mean? Fasting blood glucose. So then at 4 weeks, looks like you didn't monitor your A1C there, but as when we go to 8 weeks, look at it, you've dropped down to 5.7 from 8, and then at 12 weeks you're at 5.4, which is in sort of side the space.
If a hemoglobin A1C is below about 5.8, means you're not diabetic.
Okay.
So I went from being a diabetic to being a non-diabetic. So it's really important because in
4
to 5 months.
4 or 5 months. Wow.
So it's really important because the medical establishment wants you to believe type 2 diabetes is non-treatable. So it's
Wow.
not just the medical establishment, it's the food industry,
Yeah.
because they want you to eat all this bad food. And it's Big Pharma who sells you all of these drugs.
Well, speaking of Big Pharma, you were on all these drugs. Let's take a look at this. This is, look on the left here, my story, type 2 diabetes. Drugs prescribed by my internist, metformin, you were on 1,000 milligrams. Jardiance, you were on 20 milligrams a day. Altace, if I'm saying these things right, 10 milligrams. Amlodipine, amlodipine at 10 milligrams, Lipitor 40 milligrams, Zoloft 50 milligrams. I guess all of this was making you depressed. But then look at this, 4 weeks after intermittent fasting and real food, you've dropped down, your metformin was at 500 milligrams, not 1,000. And you're here at just all the rest of the drugs disappeared. Omega-3 fatty acids, resveratrol, spermidine, melatonin, and vitamin D3, 5,000 IU. If someone wants to sort of read about this or understand how to do this for themselves, is there somewhere where they can find this information?
Yes, so on our website at FLCCC, we have a protocol, firstly, on how to eat.
Okay.
How to eat.
Okay.
Eat well.
Great.
And second, we have a protocol on insulin resistance and type 2 diabetes. And so this is not difficult. They want you to think it's difficult because they want you to be on medications forever.
Yeah.
They want you to develop diabetes complications. They want you to go blind, and they want you to go into kidney failure. It's preventable and it should never happen. And it's a treatable disease. So I must add that on top of this, which I subsequently learned, I started taking a specific supplement, which is probably one of the most potent anti-diabetic medications. But nobody knows about it. It's a Chinese herb. It's been around for about 3,000 years, but no one knows about it because you can't get a patent on it. And if you can't get a patent on it,
Right.
you're not going to make money on it, and no one's going to sell it. And it's called berberine.
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 Okay.
So berberine actually is probably one of the most potent anti-diabetic medications we have. And this is looking at science, I mean, if you actually look at scientific data, it's probably a more potent anti-diabetic medication than metformin, which is considered the standard of care.
Wow.
So, by the way, I take metformin for another reason, not because of diabetes, but it's a very potent drug to prevent cancer, which but maybe we can talk about. Because
Well, we just tag that on. I know we brought you in to talk about this diabetes. I just want to say I had a friend just this week say, you know, I'm dealing with type 2 diabetes. I hope you're watching. Otherwise, I'll send you this episode and make sure that you're watching it. But you just dropped just a brand new explosive look into cancer.
Yeah, so basically I've gone on this new journey of, you know, challenging the status quo and challenging everything that we're told. And so it became obvious to me that cancer, you know, cancer is a big problem. You know, half of the people half of people in this world are absolutely shit scared of getting cancer. They're petrified. And it's now the commonest cause of death in men and in women. So something like 1 in 2 men and 1 in 3 women will in their lifetime get cancer.
Wow.
The costs are enormous. And what will be stunning to you is that 60 to 80% of cancers are preventable. Preventable. It's a preventable disease. Probably the most, so obviously the most important is smoking. Stop smoking.
Yeah.
Obviously. The second is insulin resistance and diabetes, which links into what we were talking about.
Right.
Insulin resistance, and this is not my data, this is CDC data. This is, you know, the establishment medical data, that about 40% of cancers are due to metabolic syndrome and being overweight and diabetes. So just controlling your weight, preventing insulin resistance and treating your diabetes goes a long way to preventing cancer. And then there's some other things you can do. Vitamin D. So they don't want you to know this because vitamin D is so cheap.
Right.
Vitamin D is very effective in both preventing cancer and in treating cancer. But again, it's so cheap.
It's wild to think about that because, you know, probably the best way to get vitamin D is to get out there and get a little bit of sunshine. And we're literally told, don't get sunshine because it causes cancer.
Yes.
You know?
So the problem is, you're absolutely right. So I have, you know, my good friend, Dr. McCullough, who spends his life outdoors. He's naked in the sun. He can get his level up to about 100 just from the sunshine.
Right.
And so that's what you want to ideally do. But most of us, so what he does is he cycles half naked at midday for at least an hour to get sunshine. That's the best way to get vitamin D.
Yeah.
But most people can't do that.
Right.
And the other people, you know, they live more north or more south, and they just can't get enough ultraviolet B. So you can take vitamin D orally, which is completely safe. It is exceedingly safe. So in fact, there was a randomized double-blind placebo study, you know, the gold standard, the ivory tower standard, the way the powers that be want. They did a simple study. They took patients, they randomized them to double placebo or to give them vitamin D, I think it was 2,000 units a day, omega-3 fatty acids, 2 grams a day, and a home exercise program. 3 simple interventions. Reduced their risk of cancer by 50%.
Wow. Wow.
Wouldn't you think that's important to know?
Yes.
Exactly, but they don't want you to know that because cancer's big business. Cancer is a business. They make money, and it would bankrupt the medical establishment if we annihilated cancer.
I always think, you know, and I feel bad. We've all been suckered in this. When I drive down the road and I see kids out there, you know, raising money for cancer, or put your quarter in here for cancer, and St. Jude and all these. And I know a lot of this means well, but I just think for all the years we've been putting our quarters into these things, cancer just continues to rise. And really, as I started investigating, working on the doctors, I thought, you're never going to get a cure to cancer from pharma. I mean, it would put so many people out of business. It would take so many of these machines, you know, all these machines that cure cancer, all the oncologists, you know, what would happen to all that? I mean, an entire billions and billion-dollar industry would come crashing down if we discovered that a vitamin or something like vitamin D could actually keep you from getting cancer. It's just not going to happen.
Yeah, so that's the problem. So that's why patients need to empower themselves, because they can't trust the system.
Yeah.
And there are things they can do to reduce their risk of cancer, which is really important. And then healthcare providers should know this, because their goal should be to improve the health of their patients.
Right.
Firstly, they should engage in a conversation with their patient.
Yeah.
That never happens because they have like 3 minutes. And so they should, talk about lifestyle changes, really important things they can do so patients can change their lifestyle and empower them to improve their own health. And then, of course, if you have cancer, there are very important things you can do. So there are a list of about over 200 off-label drugs and nutraceuticals that have been shown and proven to be effective for treatment of cancer.
Well, where do we find this paper if we want to sort of let you just sort of dropped and all this information, repurposed drugs and vitamins to sort of help us with cancer? Where do we find that at?
Yeah, so we just have posted on our website 3 days ago a monograph which I wrote on cancer care.
Okay.
It can be downloaded from the website flccc.net, and it basically goes through what I've just told you. It challenges the conventional dogma on what causes cancer, because probably that theory is probably not correct. And the treatment is based on an incorrect theory of the causation of cancer. So there's actually some data that the chromosomal theory is not correct. That's why you don't get, it's not due to genetic mutations that causes cancer, which is a big deal, because all the treatment is based on screening for these gene mutations and for treating the genetic disease. But the overwhelming body of evidence suggests that it's not a genetic disease, it's a metabolic disease. And so probably the strongest evidence—
Which is amazing, right? They love this word genetic because it means there's nothing you can do about it. Now all we're going to have to do is treat your symptoms and try to hang in there, right? Whereas—
So can I tell you, you know who James Watson is?
No.
James Watson was from Watson and Crick. They were the two gentlemen that discovered the DNA. They describe what DNA was, Crick and Watson. Dr. Watson wrote an editorial in the New York Times saying he does not think cancer is a chromosomal and genetic disease.
Wow.
And if it comes from him, he's the father of DNA. Who am I to challenge it?
Right.
So that's how far along we are in this theory, challenging this accepted theory of cancer, which is really, really important. Because if cancer is not what they think it's due to, and it's due to some other cause, that means your treatment's going to be radically different. But that would mean throwing away all their chemotherapy and all their therapies, which they make trillions of dollars.
Amazing. Dr. Marik, you're a pioneer. You always have been. It's wild to sort of watch you up close as you've really transitioned as sort of a top pharmaceutical medical specialist into a top healthcare professional, real healthcare. And it's really excited to have you. I want to thank you. Experimenting on your own bodies, also awesome, because, you get to say it worked for me.
Thank you. And, I think our goal ultimately is for people to empower themselves.
Yes.
So that they're healthier, happier, and live more productive lives. And so, we've spoken a lot about diet, but there's also exercise, and there's also good sleep and stress control. So there are things people can do to control all those 5 pillars of lifestyle. And I think if people did that, we'd live in a really healthy world, a healthy, happy world.
I think my staff's in there thinking, Del's got like 3 of the 4, the stress control lately. I've taken on a little bit too much in a few places, so it's been a little bit stressful, but I definitely sleep well. I've been exercising, food, so I'm with you on that. And you look fantastic, and welcome to sort of kicking your diabetes to the curb. It's super exciting.
Thanks for having this discussion with me, because I think it's all about just speaking, having discussions, honestly, openly, and without censorship.
Agreed. Love it. Dr. Paul Marik, stay in touch. We're going to keep watching all of your great discoveries as you move forward.
Thank you, Dr. Big Tree.
All right.